Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and as always, we're joined by our expert, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book No Time to Teach, which is the source of many of the topics that we talk about each week. And Fran, this week we are going to take another cue from the book. This is similar to last week's episode where we talked about frustration with patient education on the nurses' side, and that was initiated by some survey results that one of our customers shared with us about, just frustration with the whole process because of all the things they're being asked to do. And one of the things that came out of that was how to deal with patients that just don't seem to care. And so let's kind of focus on that a little bit today. And let's just talk about patients that don't seem to be interested, for one reason or another. And some of the reasons they might not be is because the staff may only talk in medical terms, so they don't understand what's going on. So, they say, well, I don't know what's going on, so I'm not going to communicate. They're not asking questions because of that. They may be of the mindset that you'll just give me a pill and that'll fix everything, and I'll take half of them when I leave, and that's all I'll do. They may feel helpless or hopeless. There may be a language or a learning barrier or physical barrier or something else. But from your book, you talk about dealing with patients that sometimes are this way and the need to do coaching. But before you can coach, what do you need to do?
Well, assessment, once again, is the most important thing, because you got to know what you're starting from and what the problem is.
Yeah,
Well,
clearly they're holding back. Clearly they're holding back something, and so you've got to dig deeper, right?
Yeah, and you've got to figure it out, and it may take some time. I think one of the things people think about patient education is that it's kind of simple, but actually this takes a little bit of skill, because you've got to listen for the things that are said as well as the things that are not said, and figure out where you can get in, how you can get in.
Yeah, you're looking for something that resonates with the patient that will get them to talk to you about what's bothering them.
Yeah. So you've got to, first of all, build the trust so that they're open enough to share with you. And then you've got to find out what it is their issue really is. And it could be something you don't expect at all. But unless you ask and you stay open and you pay attention, you're never going to find out. And then you won't know how to proceed.
Yeah, because they could be distressed about something. They could feel that maybe you guys don't know what's going on, and so they feel kind of helpless and are not sure what to do. They could be very sad about what's going on and think, well, this is not going to go well. But an important point that you bring out, and you talked about this last week too, is trying to find out what their goals might be. They may not know that they have goals, but everybody thinks about things that they want to do. And you mentioned like living long enough to see grandkids, things of that nature.
And that could be a hook.
Mm-hmm.
So if you find out what it is they care about, it may be just that they want the pain to go away. At least you could work with them towards that goal, and then build the trust even more, and then move forward into other things that might actually help them get better.
Yeah, and this is where the coaching comes in addition to the education part of it, because the nurse has to become a bit of a coach to kind of encourage the patient to go down a path. And you mentioned a couple of different things once you've kind of identified kind of what's going on with the patient, and they may have some disagreements about their behavior and how it conflicts with what they need to do to get well. They may have some different expectations, things of that nature. But one of the key goals that is to help the patient understand the risks and the problems with their behaviors that might have made them ill or come back to the hospital in the first place. Is that correct?
Yeah, so if you can find out what it is they care about and how they think they're going to get there, and if they're misinformed, if they believe something that isn't accurate, if you can help them learn to question it and to see the problem with it, then you can move forward with having them change their point of view a little bit.
Yeah, and I'll put in a plug for a video on this because a lot of times some of the issues that you're dealing with can be best described in terms of emotion, feelings, and then also very poignant illustrations of what can happen if the behaviors continue. And video, or well done video, can do that better than just a couple of minutes of chit chat. I think anyway.
Absolutely.
And by introducing that, it can at least help to focus what some of the issues are, and then it's up to the nurse to be the coach and help the patient to realize that, yeah, that could be them if they don't make a change, correct?
Well, video is good because it does hit the emotional part, whereas not everybody responds to logic, especially when you're trying to convince them of thinking a different way.
Yeah.
But if they can feel it first, that will help make the shift much more easily.
Okay, yeah, that makes a lot of sense. Now, after you have discovered some of the issues, you talk about helping them make a plan. What do you do there?
Well, I think the key is to make sure that it's not your plan, it's not your goals, it's the patient's plan and goals, so that they can come up with something that they perceive as doable. So they're not trying to please you, they're not trying to just say yes so they can get out of there, where they're coming up with something that they could, and maybe it's just a mini step, a little step towards what it is you think they should be aiming for, but it's in the right direction. And once you succeed at something little, then you can move on to something bigger. So it's a process. We have to be patient. Things don't change immediately ever. It's all about behavior change. So we need to be patient with it and work with it.
Yeah, it's funny. We all talk about change is good, progression is good, but when it comes down to us making the change, no, it's not so good.
It's not so easy because habits are so ingrained.
Mm-hmm. Yeah, they really are. And I think it's really important that you talk about them making the decision as opposed to the nurse, because if it's the nurse's decision, it was what they, it's really got to be about them. And excuse me, you talk about in the book little behavior change that they can do, or options that the patient thinks they are most likely to do. An example might be a diabetic who will say, okay, I'm going to stop that extra piece of cake every night that I usually have, or something like that, right?
As long as I can have one piece of cake, it's okay, but I don't need the two. Yeah, I mean, it's it's got to be doable, and it's got to be their decision. And then you could come up with kind of a summary of, okay, so you decided that this is important to you, this is what you want, this is the first step you're going to take. It's doable, and if you don't succeed once, it's okay. You go back, you try again the next time. So it's supporting the behavior change and making sure it's clear to them that they're making the decision and not you.
Yeah, and basically what you were just talking about is the part where you talk about taking action and helping the patient commit to that first step. And it's also important that they understand not only how to tell if something is wrong, but if it's working, which would encourage them to continue, correct?
Yes, that reinforcement of, wow, I feel better.
Yeah.
Something is easier. I'm losing weight. Whatever the issue is, helps move things forward.
Yeah, and I think also from your book, you talk about it's important that the nurse get the patient to verbalize how they will take this first step. What will they do? Whether it's continuing to take medication, change in diet, make sure they call the doctor, but there's got to be some kind of a commitment on what they feel like their first step is in order to kind of get the ball rolling, right?
because it's got to fit into their life and the way they structure their behaviors.
Mm-hmm.
And it's very important also then to follow up when you see the patient again to find out how it worked.
Right.
And if it didn't work, ask the patient what else might have helped, or maybe something else altogether. You've got to keep the conversation going.
Yeah, no doubt. And the coaching, like anything, is an ongoing process. It's not a hard, fast start or a hard, fast end to it. It's an evolution of communication and conversation, and you often refer to the most important thing is the conversation. If you're not having that, there's nothing going to happen, right?
Right. Well,
Okay.
it's kind of like the second level of patient education. The first level is to make sure they have the information,
Mm-hmm.
that they have the facts, and then the second level is, okay, how do you apply this to life?
Yeah, and all of this basically is different from discharge, which is more like these are key things that you need to pay attention to when you leave. These are educational issues that you've uncovered while they're in the hospital, not the last 11 minutes that they're there, right?
Exactly. This happens from the relationship, from the conversations.
Yeah.
And you may find out, that the patient keeps getting readmitted for a certain problem. But if you can have these conversations and discover the root of the issue, perhaps you can stop the readmissions from happening.
Yeah, and of course the readmissions would be your red flag, right?
I love my red flag.
Okay, all good advice, and this stuff is in more detail in your book on pages 158 and 159. So we would encourage folks to take a look at that. So why don't you tell everyone where they can find you online?
I have a blog at notimetoteach.com, and I'm on Twitter at notimetoteach.
Okay, and your book is available at Amazon and other booksellers in ebook and paperback form, and they can also get a discount for bulk purchase by going to your publisher, Pritchett and Hull, and their website is p-h.com, and we encourage folks to go out and get a copy because a lot of this good information that we talk about is in the book, and they can refer to it anytime they want. And for those hospitals out there that would like to add video to their education to support their nurses and patient educators, please visit our website at synergybroadcast.com and look for our patient education system we call MMDS, or Medical Media Delivery System. So Fran, thanks so much for your time today. Some good advice on how to be a good coach for your patients. We appreciate it and look forward to speaking with you next week.
Bye, Jack.
Bye-bye.